guys, this is Jess, the nurse at STL Fertility. In this video, we're going to discuss your dual trigger shot with Novarel. The first step in any injection is to ensure you have proper hand hygiene. To do this, you will want to use soap and water and then dry efficiently. At that point, you can then gather your supplies for your injection. The first step is to gather your supplies. This will require 2 different medications, so we're going to talk about how to prepare both of those. The first of which is your leuprolide acetate, so you'll need that, your insulin syringe, you'll need 2 alcohol prep pads for the injection. You'll also have a syringe with a needle attached to do your mixing. For your Novarel, you'll have a 1-inch needle for the injection, and then the Novarel comes in a powder and a saline vial and a sharps container. The first step we'll talk about is the Lupron. How you do this is, it's an insulin syringe with a needle attached, and you're going to draw out to 40 units, which is on the syringe. You'll just put your needle inside of the black hub and invert to draw back to the 40 units. Right there. And you can remove your vial. This one's ready to be injected, so we'll set that aside. The next medication we're going to talk about is the Novarel. Now, your dose is likely 1,000 units, but please always refer to your calendar. To do this, Novarel is 5,000 units, so we will take 5 mils of water to dilute your powder. You will have to dip your syringe into the water several times because this is a 3 mil syringe. So I'm going to remove the caps off of these. You will put your needle into the hub and then again invert to bring the fluid down to draw out. We'll first draw out the full 3. Take that off and you will inject that into your powder. And then we need 2 more mils to get the full 5. So we're going to put this back into your water and you'll withdraw 2 mils. If you get bubbles in there, it's okay. Just draw back a little bit more and push up till you get to that 2 mil mark. Remove it from the water and you'll inject 2 mils into the powder. Once that's all diluted, you're only going to withdraw back 1 mil of this. So we're going to flip this back upside down and draw out 1 mil. Again, I always draw back a little bit more. That way I can push up and get that air bubble out, and there's your 1 mil mark. You can then remove your Novarel powder, and this can get refrigerated. So just put that in the refrigerator. You will twist off your mixing needle. And again, sometimes this can get tricky, but what we'll do is you'll recap this, which is never always advised, but sometimes you have to just to get this needle off. And then you'll attach your injection needle. And what you'll want to do here is just prime the needle by pushing up ever so slightly till you see a little air bubble at the top, and you're all ready to inject this in your deltoid. All right, guys, so now we're ready to inject the 2 trigger shots that we have prepared. The first one we're going to do is the leuprolide acetate, and this is a subcutaneous injection, which by now you're probably an expert at. You've been doing this every night, for the past couple nights. So what we're going to do is you're going to find a spot about 2 finger widths to the left and right of your belly button. Stay at the level of, and you can go even a little bit below. You'll take your alcohol prep pad and clean the site in a rotating motion. You will then pinch the skin, take your Lupron, which is the one with the insulin syringe, and then go in at a 90-degree angle, release your pinch, and inject the medication. Leave it there for a second or 2, and then you can withdraw the needle. You will then take this and dispose of it in your sharps container. The next injection is the HCG, and this is the one that's going to be intramuscular in your deltoid muscle. This is kind of where you would get a flu shot or a vaccine. How I tell people to find the spot for this is you're gonna follow the shoulder bone here at the very end. You'll make 3 fingers and go down the arm, and you're gonna go right below that bottom finger, okay? You'll take your alcohol prep pad and clean the site. And instead of pinching the skin, you're actually gonna spread the skin pretty taut to make it nice and tight, and you'll put the needle fully in and inject your medication. Thank you for watching this video. If you have any questions at all during your IVF cycle, your trigger, always please reach out to your coordinator either via portal or calling at 314-983-9000.